So I'm Ashley, the founder of Birthsmarter, and we teach childbirth education classes and a whole bunch of other really awesome classes for pregnant people and postpartum people. And as part of our offerings, we also just really like to hang out with folks who are pregnant and postpartum and people who work with pregnant and postpartum people. So we do this community conversation series. Also, I personally just really love learning things and connected with Origin PT, which is LA based and like very quickly growing all over. And I'm really loving their mission and our shared commitment to just like reaching more and more people with information that we know everyone should have and information that is going to make people's lives way better. And pelvic health is really at the core of what Birthsmarter teaches when it comes to childbirth ed, which we think should be in every childbirth education class. So I'm really excited for this, and I'm not going to say very much else until we do the Q&A. Caitlin, I'm going to hand it to you. Thank you so much for being with us.
Thank you, Ashley. I'm just going to share my screen here. Nope, that's on my email. Whoops. Okay, can we all see that?
Yes.
There we go. Okay, so yes, I am from Origin, which we're based out of Los Angeles, and we are physical therapy designed for women and mothers. We are on a mission to help women feel their best through every stage of life. So we initially started primarily as a pre and postnatal physical therapy practice, and we're now trying to really expand and help women throughout every stage of life with non-invasive and affordable care for some of these issues that we know are so overlooked sometimes in the medical community. And a lot of times they start early with things like painful sex, or they start around childbirth and continue throughout the whole life. So it's our mission to kind of intervene when we can and make progress with some of these areas that have traditionally been really overlooked. Our slogan is at Origin, there's no such thing as TMI. So definitely welcome all of your questions. So my name is Caitlin. I'm a physical therapist from Boston, Massachusetts, and I have a background in nutrition and fitness training. So I like to pull that into my PT practice. At the moment, I am also 17 weeks pregnant with my first. Thanks, guys. All right, so we're going to be talking today about pelvic floor 101. Essentially, what's the pelvic floor? What's normal? What happens to the pelvic floor around pregnancy, labor, delivery, and postpartum? And then when it might be a good idea to seek extra help or help from a pelvic floor PT. We're also going to go through a couple of exercises today so you get a sense of what you can start doing on your own and really like which exercises might be appropriate for different stages around pregnancy and postpartum. Okay, so first up we've got what is the pelvic floor and what does it do? So the pelvic floor is a group of muscles and connective tissue that make up the floor of the pelvis. So you can see on my picture over here on the left that it quite literally, this is looking down into the pelvis, and I have a model as well. When you have your pelvis looking down, these muscles quite literally do make up the floor of your pelvis. And it's muscles, it's fascia, it's ligaments, it's connective tissue, this whole layer that's holding everything up underneath the pelvis. The muscles have 5 main functions. So we like to think about them around like peeing and sexual function, but they actually have 5 functions. So the first one is actually physically holding the organs and everything up against gravity. So normally it's holding your bowel, your intestines, your bladder, your uterus, everything up against gravity. During pregnancy, you've got all this extra weight from a baby that it's also holding up and supporting you throughout the day. The second function is continence. So when the pelvic muscles contract, they squeeze around the urethra and the anus to prevent you from leaking urine or stool. The third one is stability. So these muscles are an integral part of your core. When we think of the core, a lot of times we just think about the abdominal muscles, but the core actually consists of everything. So your diaphragm, your abdominal muscles, your back muscles, your pelvic floor muscles, and your hips all work together to stabilize your core. The next one is sexual function. So pelvic floor muscles have an important role in erection, pleasure, orgasm, and pain. And the last one, which isn't talked about too much, is that they also function like a sump pump. So this can be especially important during pregnancy if you're somebody that has more swelling or stagnation of fluid around the vulva, maybe vulvar varicosities, varicose veins. The pelvic floor muscles contract and relax and actually help promote circulation and pumping fluid out of the pelvic floor area. All right, so many different functions for this group of muscles that most people don't think about until they really have to. So how do the muscles work? So like I said, the urethra, the vagina, and the anus all travel directly through these muscles. And we have a side cross section here. So you can kind of see the urethra coming from the bladder, the vagina coming from the uterus, and the anus coming from the rectum. All of these create pathways through the pelvic floor muscles. And the pelvic floor muscles do three things here. So the first one is that they squeeze and lift. Squeeze and lift upwards, and again, that is what allows you to stay continent, to stop yourself from leaking urine and stool. The second thing that they do is they release and lengthen, which of course is necessary for pain-free sex or penetration. And the final one is that they bear down, or the muscles can bulge outwards, which allows you to either pass a difficult bowel movement or be able to push a baby out. So the muscles, like I said, work together with your abs, with your diaphragm, and with your hip muscles. And so in pelvic floor PT, if we're working on strengthening or releasing those pelvic floor muscles, we like to focus on the whole picture. So it's not just doing Kegels, but it's addressing what's happening with your hips and what's happening with your core and with all these other muscles that work together. All right, so what's normal when it comes to pelvic floor function? So the first thing with urination is that we like to see in a normal pelvic floor that you are filling up your bladder completely and peeing 5 or 6 times a day, which if you're pregnant probably doesn't seem like very many times. It's also normal to have some leaking of urine for the first 6 weeks postpartum only. So we prefer to have you to have the ability to be able to easily and completely empty your bladder, so no straining to pee, and then no increased urgency. You should feel like you can get into the car and drive to the store and not feel like you have to pee just in case before you get into the car because you're worried that when you have to go, you really have to go. For bowel movements, which is another thing that we talk a lot about, we like 1 to 2 daily bowel movements, and we like to see a number 4 on the Bristol stool chart. So this is this chart over on the left here. Number 4 is a nice smooth sausage shaped stool that you're able to pass really easily without straining or without pain. All right, so we talk a lot about lifestyle modifications in pelvic floor PT as well. If your stools are looking too loose or runny, or if they're looking too hard because of constipation, then we address those lifestyle factors and talk about how we can make bowel movements easier from that nutritional standpoint too. And then for penetration or sexual function, we want to be able to have pain-free and pleasurable intercourse. And of course, no pain with penetration from tampons or with pelvic exams. Okay. So what happens during pregnancy, labor, and delivery? So pelvic floor strengthening with exercises like Kegels helps to prevent complications. Some of the big ones are going to be urinary urgency, urinary incontinence, and prolapse. These can happen during pregnancy or they can happen during postpartum, and doing some strengthening during pregnancy can help prevent or improve those. It also helps to work with improving stability of your pelvic girdle. And by pelvic girdle, I just mean all of the bones of the pelvis. So your 2 pelvic bones and your sacrum in the back, this whole thing makes up the pelvic girdle, which can be a little bit unstable and cause pain during pregnancy. We see a lot of pubic symphysis pain in the front of the pelvis, as well as sacroiliac joint pain in the back, low back pain, hip pain, things like that are improved with a stronger pelvic floor because it functions as part of your core. And then a strong pelvic floor also is shown to help with fetal cardinal movements during labor and delivery. So what that means is that as your baby's head during labor is kind of working its way down through the pelvis, it doesn't just go straight down, it moves in different directions and rotates as it goes through the pelvis, and having a strong pelvic floor can help to position the head as it moves through. So in addition to strengthening the pelvic floor, the release is just as important. And this is what I think is a huge, huge takeaway for pregnancy strengthening, is that you can strengthen, but you don't want to lose the ability to relax and release those muscles, because you have to release and you have to bear down to effectively be able to push that baby out. And I usually recommend that if you're getting close to delivery, like within the last couple of weeks, it's a good idea to actually use a mirror and practice pushing with the mirror so you can see what that looks like. Especially if you end up getting an epidural and you might have limited sensation, then using a mirror can really help you know, are you pushing effectively? All right, so because of that extra weight on the pelvic floor during pregnancy, some positions might be easier for you to squeeze and some positions might be easier for you to release. So it's helpful to try pelvic floor exercising in different positions like side lying, sitting, hands and knees, and that might give you some good insight too about what positions might be best for you during labor. Okay, so then postpartum, what to do after baby. So in the first 6 weeks, remember that I said that leaking of urine and even a sort of feeling of heaviness in the pelvic floor is normal and might heal all by itself, improve spontaneously just as your tissue is healing during those first 4 to 6 weeks. It's okay to start doing some gentle Kegel with breath, which we'll talk about in our movement portion at the end, to just start to engage the muscles a little bit and help reduce swelling. But you're not going to be doing any penetration. You're not going to use any pelvic floor trainer or do any intense exercise until you go back for that 6-week follow-up with your provider. So whether it's an OB or a midwife, typically you'll go back to see them at 6 weeks, and that is when they will clear you to do any sort of penetration vaginally. So even in pelvic floor PT, we don't examine the pelvic floor internally until after that 6-week mark. All right, so post 6 weeks, once you get that clearance, now if you do continue to have leaking, pain, or heaviness in the pelvic floor, then that's no longer normal. So at this point, you can definitely start doing more strengthening. You can even use a pelvic floor trainer, which some of our favorites are the LV, the Kegel, and the PeriFit. And this is the LV over here that I have a picture of for you. These are just some devices that you can insert vaginally. They'll show you how to do pelvic floor exercises, and you have an app on your phone that goes along with it, so you can kind of play video games and things with your vagina, which keeps you a little bit more accountable and makes Kegels a little more interesting.
Caitlin, do you recommend that somebody use the LV or some of these trainers in pregnancy or only postpartum?
I typically would only recommend it during pregnancy in specific cases. I think that doing excessive strengthening during pregnancy isn't usually needed, but if somebody was coming in to me with already they had a prolapse or already they were leaking before they even became pregnant and we really needed to do some intense strengthening, then I would say there's nothing wrong with it. I would just have them check with their OB, of course, in case there's anything else going on.
Yeah, okay. 2 more questions came in. Do you want me to wait till the end though?
No, you can throw them at me, that's fine.
Okay, can someone do too much when it comes to strengthening the pelvic floor before birth?
I would say yes. And the key is maintaining that ability to release. So a lot of times I will have patients who just are told, like, do all the Kegels that you can. And the pelvic floor really needs to be the perfect balance of length and strength. And so if you are just like at every single stoplight or at every TV commercial, you're doing like 100 quick squeezes and you're not relaxing completely between each one, then that's where you could definitely risk your muscles becoming too tense and you could have a really hard time relaxing enough to deliver a baby.
Yeah. Somebody else is saying, I asked my OB if I should do Kegels during pregnancy because I was having some leaks, and she said she recommends only after the baby is born, as if we do any exercise incorrectly, we could actually hold the baby like more inside, and it can be harder on delivery. And now, like, there's mixed messages. I think that's what's complicated about just what, like, more people are coming into women's health PT and understanding the pelvic floor. And so there's new information and old information. But at this point, I think everyone in our circle, probably in women's health PT and in the birth community that understands the pelvic floor, is in agreement that prenatally it's more important to focus on the release as a generalization. And as a generalization postpartum, you're thinking more about strengthening. But this is where working with someone is really helpful because every body is so different, right?
Definitely. If you're somebody who's coming in with a pelvic floor that's already tight, maybe we're already having painful sex or things like that beforehand, then I'd be much less likely to say start doing Kegels versus somebody who was already leaking from a previous pregnancy and we know their pelvic floor is weak. It just depends. And there isn't an easy black and white answer.
Yeah. Okay, last question, then we'll keep, well, actually I have one too. Okay, here's one from someone who came in. A postpartum doula told me that squats have been found to be as or more effective than Kegels. Do you have thoughts on this?
So we know that when you strengthen the muscles of the hip, it has an overflow effect into the pelvic floor. So when you do hip strengthening, whether that's squats, whether it's like banded side steps, things like that, do strengthen the pelvic floor without you having to do Kegels directly to some extent. But I don't think that I've seen any evidence that they're more effective than pelvic floor specific exercise. In fact, I think they need to be used hand in hand for somebody that really needs to strengthen. And I will also say that the same kind of goes for if you're doing really deep squats, like trying to really stretch, like a yogi squat. That also has an overflow effect where when you stretch the hips really deeply, you get a deep stretch in the pelvic floor muscles too, which can help you learn to release better. But again, I think it's good as part of your program, but if you're not diaphragmatic breathing and you're not learning how to release the muscles directly, then I think you're still missing part of the puzzle.
Yeah, that makes sense. Also, I'm just rereading this question that came in, but it was someone who was doing Kegels because they were having some leaking. And I feel like one of the big misconceptions I hear a lot when folks come to class is that they think they need to be strengthening more when they're leaking, and they don't realize that sometimes leaking or some of the other things you listed in the beginning, pelvic floor dysfunction, can come from being too tight and not too weak. Would you talk about that?
Yeah, this is on my next slide.
Perfect.
Yes, so I always say that Kegels are important, but they tend to be, they're not a one size fits all exercise. And your pelvic floor symptoms can come from many things besides just a pure strength deficit. So it might be just that your muscles are weak. It might be that you're lacking coordination or endurance and you're having trouble contracting and releasing quickly. Or it might be that your muscles are actually too tense. And in this case, you're gonna see Kegels making leaking or painful sex or any of these things, it can make them worse. So I see this a lot around cesarean deliveries, where patients kind of expect after you have a C-section that you're kind of gonna get off scot-free because your pelvic floor is unaffected. But in reality, you've got a baby sitting on your pelvic floor muscles for 9 months, and then that baby's just suddenly gone. And your pelvic floor muscles have been in a state of tension and muscle guarding for that whole time that you were pregnant. When the baby comes away, sometimes the muscles stay really tense. So for those patients, sometimes you have leaking afterwards. And if you don't get a PT assessment, if you're just starting Kegels on your own, you'll see that your symptoms get worse because it's that length strength relationship again. The muscles have to be the right length. If they're already tense, then they're not going to be strong because there's just nowhere for them to go. They need to be able to extend fully to be able to get a strong contraction. Does that answer your question, Ashley?
Yeah, it does. It's really helpful. Thank you.
So then I always say that, especially if you're not doing PT and you're not being monitored by a provider, if you do start doing Kegels postpartum and you either have more leaking or you start to have painful sex, then just stop doing the Kegels and focus on just diaphragmatic breathing, which is a technique that we use to learn to coordinate with your breath to release the pelvic floor muscles. Your diaphragm and your pelvic floor should really work together like a piston. And many times with the way that we breathe when we're stressed out or when we're just holding our abs in or doing other things in our life, we tend to kind of fight against our pelvic floor. And so diaphragmatic breathing is kind of this foundational thing that everybody should know how to do, where you can get your breathing and your pelvic floor to match and to work together. And it really helps with relaxing and releasing. So we're also going to talk about that a little more in just a minute. Okay, so returning to sex after you have a baby. So there's many, many reasons why sex can end up being a lot less comfortable after childbirth. The first one is that there probably will be some decreased lubrication. This is hormonal. It's worse if you're breastfeeding. And sometimes breastfeeding can also kind of slow tissue healing. So sometimes we see some areas of like red raw tissue after having a baby that it's just everything's kind of slowed down and drier because of the hormonal changes with breastfeeding. You also might have some scar tissue. If you had any perineal tearing or an episiotomy, then scar tissue can limit the flexibility of the vaginal opening. You can have overactive tense muscles, which we talked about. You can also, from just a mental standpoint, a psychological standpoint, you can have some very real birth trauma if things don't go the way that you're anticipating. And definitely some post-traumatic anxiety or postpartum anxiety can really have an impact on your ability to relax and enjoy sex, as well as your body goes under these massive, massive changes over pregnancy, and then right away with postpartum, your body changes so drastically. And so really being comfortable, being intimate, that can have a big impact on just your psychological response to sex as well. So this is my little reminder that you deserve to have a pain-free and pleasurable sex life after you have a baby. So definitely use additional lubrication, that can help. The one that I have the picture of over here is Slippery Stuff. It's a water-based lubricant that we use in the clinic. It's nice because it'll just kind of dissolve when you're done with it. It won't stain your clothes or anything like that. And it's safe to use with silicone devices too. Practice your diaphragmatic breathing. So if you're having painful sex, stop doing Kegels and try doing some diaphragmatic breathing for a couple minutes before sex or even during, and see if that helps. Go slow, communicate with your partner, make sure that everybody's aware of what's happening, where you feel pain, when you need to slow down, or when you need to stop. And the big thing as well is try not to force it. As much as we want to try to get back as soon as possible, if you are having pain, you don't want to kind of reinforce any negative trauma patterns or anything like that. You don't want it to be a terrible experience because it's going to make it harder to have sex again in the future. So don't force it, stop if you need to, and take your time. So we're going to talk last about when you might need extra help or when to go see a PT. And so pelvic floor PT, we treat all sorts of things that are quite common after a baby, but not considered normal. The big one, of course, is urinary leaking or stress incontinence. That's usually when you have leaking with jumping, coughing, sneezing, exercise. We also treat urinary urgency or having to go pee too much or not being able to wait. We treat pelvic organ prolapse, which is when the pelvic organs, because of weakness in the pelvic floor, can sort of descend down after you have a baby. We treat painful sex or painful penetration, also, like I said, including tampons or pelvic exams at the gynecologist, any of those. And we treat scars for both perineal tears, episiotomies, or cesarean sections. And then outside of that pelvic floor realm, we also treat pain during pregnancy, pain postpartum, like neck and shoulder pain from carrying the baby. We see a lot of that. We see abdominal separation and helping people get back to exercise safely, as well as some of the other smaller things like mommy's thumb, carpal tunnel, mastitis, clogged milk ducts, pretty much anything with your physical body that gets in the way of your optimal function. So pelvic floor is a pretty complicated topic, and I know that this 101 is really scratching the surface, but I think that you guys can see from what we talked about already that it is fairly nuanced, and there's a lot that you can do at home. There's a lot you can do on your own, but if you get stuck or if you're confused or if anything that you try doing at home makes your symptoms any worse, then I highly, highly recommend seeing a pelvic floor PT, because it's much easier for us to prescribe things specifically for you once we can assess and really see what's going on. All right, so I have a couple of exercises to try. Did you want me to go through any other questions, Ashley, or should we jump in with these?
Yeah, let's jump in with movement, and then if folks have questions, they can write them in now. Yeah.
So I have just 3 things to go over with you for movement today. And then I just kind of checked off on this chart when is probably the most important time or the most safe time for you to be doing these different exercises. So it's not to say that you can't do elevators during pregnancy. However, I think that working on the ones that are checked off are probably your top priorities and are going to only make things better for the most part. All right, so the first thing, and you can definitely do this just sitting and watching this right now. We're gonna just kind of talk through it, but I definitely encourage you to try this in different positions, because like I said, especially if you're pregnant, you're gonna see that it's easier or harder to engage, easier or harder to release, depending on if you're sitting upright and gravity's pushing that baby down on your pelvic floor versus if you're lying down or you're on your hands and knees. So we're gonna start with diaphragmatic breathing, which, like I said, this is kind of your go-to if you're having any pelvic pain, painful sex, and this is safe to do anytime. Everybody should probably be doing this once in a while or after any intense exercise, because it's so important to work on that coordination of your breathing with your pelvic floor. So with this, what I'd like you to start with is we're gonna start by thinking about the diaphragm first, and I want you to practice breathing with your shoulders down and relaxed, breathing into the belly. Kind of move my camera here. So breathe into the belly, let your belly expand forward as you inhale, like you're filling up a balloon, and then just let the air out. Let the belly expand, and let the air out. And I'm gonna bring your attention to a couple of other areas, but focus first on trying to get the belly to expand without letting the shoulders shrug up. On the next inhale, think about now expanding laterally through the ribs. So in addition to letting the belly expand, you're also inhaling into the ribs all the way around. And again, if you have trouble sitting, you might find that this is even easier lying down. But we're trying to get this whole abdominal cavity to expand with your inhales. Okay, now we're gonna add the pelvic floor in with this. So again, if you imagine this whole thing is a big balloon that's expanding when you inhale, that means the pelvic floor is gonna drop and expand as you inhale, and then you're just letting the air out. Every time you inhale, we're trying to expand a little deeper, release a little more, and then just let the air out. I like to think about this for me. It helps to imagine my vagina actually opening. Or I like to think about what it would feel like if I'm trying to pee in the ocean. Release on the inhale, and then just let the air out. Release on the inhale, and just let the air out. Release on the inhale, and let the air out. Let's take just a couple more breaths. Let the belly expand. Let the pelvic floor open. Okay. All right, so the next one that we're gonna do is what I call the basic Kegel with breath. And I really like this during pregnancy because this is one that's gonna encourage you to maintain that ability to release the muscles. without being too intense. I don't really recommend doing like quick squeezes during pregnancy. That's more likely to cause that difficulty pushing and bearing down. So this one's really gentle, and you want to keep focusing on that release that we just did with the diaphragmatic breathing. This is also the good one that you want to start doing in that first 6 weeks postpartum, because it's going to help with blood flow and getting rid of any swelling and promoting healing. So with this one, we're going to do the same inhale. So when you inhale, the belly and the pelvic floor expand and release. When you exhale, you're going to squeeze and lift like you're trying to stop yourself from peeing. Focus right on the pelvic floor muscles. Try not to squeeze your butt. So you're going to inhale, full release like you're trying to pee in the ocean. Exhale, lift and squeeze like you're trying to stop yourself from peeing or stop yourself from passing gas. Inhale, release completely. Exhale, squeeze. Inhale, release completely. Exhale, squeeze. And so if you're just going with your normal breath, you end up with about a 2 or 3 second squeeze and a 2 or 3 second release. And it gives you plenty of time to move through the entire range of motion and to not neglect the release portion. Inhale, release. Exhale, squeeze. Let's do like 3 more. Inhale, release. Exhale, squeeze. Inhale, release. Exhale, squeeze. Make sure you're getting a full release on that inhale. And 1 more squeeze. So you might notice that your deep core muscles, your transverse abdominis, is kicking on a little bit with this, which is totally fine, as long as you're actually feeling the pelvic floor. You want to feel the muscles around the vagina, around the urethra, around the anus actually contracting, not just your butt, not just your abs. Okay, so the last one, which is a little bit more advanced, which you can certainly still try if you're pregnant, but this is one that I love to give to my postpartum mamas. That's a little bit more intense, and it involves a little bit more coordination and endurance. So this is called elevators, and I like to start this with 2 levels. So you're going to start with that same release as you inhale, and then as you exhale, you're going to squeeze up 50%, 100%, back to 50, back to 0. Take a breath, squeeze up to 50%, 100%, 50, and 0. And that's it. We're controlling the coordination. We're holding a little bit longer, and especially on the way down, that's the hardest part. Exhale to 50, 100, 50, and 0. Take a breath. Exhale to 50, 100, 50, and 0. Let's do just a couple more. Exhale to 50, 100, 50, and 0. Exhale to 50, 100, 50, 0. Last one. 50, 100, 50, and 0. So if you are somebody that has a little bit of trouble releasing the pelvic floor, then you'll notice when you try to do these elevators that they get harder and harder as you go. More than anything, it's because you started out with your full range of motion, but if you're not releasing all the way, then a couple reps in, now you're working in this range of motion, which is a lot harder to do. Much smaller range of motion, it's gonna feel a lot less strong. So if you were coming in for pelvic floor PT, these exercises are an awesome start. We tend to start incorporating the pelvic floor with more functional movements. So if we really want to get you strong, maybe we want to get you back to running, we'll start doing a pelvic floor with a Kegel with a squat, a Kegel with a jump. You know, we add on from here, but these are some really good things that you can do on your own and kind of monitor your progress to see if it's making your symptoms any better, or of course, if they're making it any worse. All right, so that's all I've got for you.
That was awesome. I'm having like a yawn attack every time I do diaphragmatic breathing after not doing it for hours. You know, it's like, oh my gosh, I needed more oxygen. Okay, so here's 2 questions. It's also helpful to do a reverse of the first exercise during pregnancy as the prep for pushing. So you're down training, releasing on the exhale rather than the inhale.
So when I teach pushing, and this is actually what I didn't talk too much about in the slides, but when I teach pushing, I still teach that you're releasing on the inhale, but when you push, you're maintaining that release and you're adding an abdominal contraction, and then it becomes like you're squeezing a tube of toothpaste. You already got the cap unscrewed because you released your pelvic floor, and you squeeze the tube of toothpaste, that pressure should go downwards. So I still like to do the relax on the inhale and then maintain that relax while you push down on the exhale.
Kate, tell us if that makes sense for you. That makes sense to me. I teach a pushing workshop, so she took mine, but it makes sense. Okay, I like that idea too, where you're like loose, you're taking off the cap of toothpaste and then pushing out there. That's helpful. Okay, so someone is describing pelvic pain and said that the midwife sort of normalized it, and this talk is making them think that it's not so normal. So here's more of a description, and any tips would be appreciated. This person's 26 pregnant and has been getting aches and pains around the pubic bone and between her legs. They're most obvious when walking more than a few minutes or rolling over in bed. Is this something I should work with a pelvic PT to address, or practice the diaphragmatic breathing to see if it helps?
So this to me sounds like, and I don't want to say that I'm diagnosing you without actually assessing you in person, but this sounds like pretty textbook pubic symphysis pain. So I would definitely see a PT, and it doesn't even have to be a pelvic floor PT. Anybody who has some familiarity with pregnancy and pelvic girdle pain can help you with that pubic bone pain, which is very, very, very common during pregnancy. And it's just because this little joint in the front of your pelvis becomes unstable, and doing things like walking or rolling over in bed will pull and tug at that joint and cause pain. So I would see a PT and try to avoid activities that aggravate it.
Caitlin, Origin is not yet licensed to treat people in New York. Is that right?
We have one PT that is, actually. So we're doing telehealth in New York.
Cool. So that's an option for everybody here. There's a few people from Brooklyn, and I'm fairly certain that the person that asked that question was from Brooklyn. So if they want more resources, I just have a big PT network that I can help refer you to. Okay, so then other folks can ask questions. My question, going back to the trainers, the pelvic floor trainers, I'm curious if you have opinions about the Epino, or have heard about it, or for other folks. So the Epino, my understanding is that it's not like really well, it's not common here because you have to get it from overseas. It's not FDA approved, but it's like the balloon that you're inserting into the vagina and then you're inflating to help stretch. So this is a different thing because it's not for strengthening, right? It's more in the perineal massage category of push prep. Yeah, do you have any thoughts about that?
So I have definitely heard of it. I have not had my hands on one before, so I can't speak to say if it works better or worse than just doing perineal massage, which is something that we teach. Essentially, with both of those modalities, the goal is to get your muscles just used to the stretch, because that can be quite shocking if birth is the first time that you've ever felt that much stretch in your vaginal muscles and pelvic floor tissues. So I think it's a really cool idea, and I would really like to get my hands on and try one. But yes, they're not FDA approved, so I haven't seen one in person yet. But I think it's a cool idea. I don't think necessarily that you can't do the same thing with perineal massage, which is good.
I feel like you should bring it back to the team. I'm wondering if Origin now has some purchasing power or connections overseas where we could try one out and talk about it. You're in a good position to get your hands on an Epino.
Definitely.
Okay, so my other question, here, I'm going to ask a follow-up question to this, but does perineal massage help to not tear as badly?
So perineal massage, I usually start recommending it within the last month or so leading up to delivery. And it definitely is shown to help. The most important thing is, like I said, to get your muscles just used to that stretch so that they're not tensing up and fighting against you when they feel it for the first time. So doing perineal massage, I've heard so many different techniques. I think for me, doing the actual massaging with lubricant or oil and just bringing blood flow to the area is important, but I think the most important thing is that stretch. So I like to recommend that you get your thumb right onto the edge of the vaginal opening and just stretch downwards for 30, 60, even 90 seconds, and then kind of do the same thing off to each side to just start to improve your tissue's tolerance to stretching.
Okay, so I'm going to uncover a bias here that people usually only hear when they take push prep with me, but I'm curious to hear your thoughts, and like feel free to disagree because I would love to, hash it out with someone. But I remember hearing about perineal massage like maybe 5 years ago, 6 years ago, as it became more popular. And my initial personal reaction was like, no, like, wait, no. Which just tells you something about the sort of birth educator I am. Like, I really try and teach people as intellectually as possible without getting close to the body. But I have since learned a lot more about the pelvic floor and about childbirth and about mental health and anxiety and breathing and more about my body. And I've taught, hundreds of more clients. And I have this sense that's not based in, scientific research or data collection in any way. I have this sense that there's a group of people that are so excited to do perineal massage. They're like, I hear that like this is going to help me not tear, and I'm totally into it. And then there are people that don't really want to do perineal massage. And the advice I've been giving lightheartedly is I think the people that don't want to do perineal massage absolutely should do perineal massage. And if you really are into it, it's sort of like it might help and it might not help. But for me, it seems like there's actually stretching the tissue, right? Like you're saying, increasing the tolerance, but there's also just mentally wrapping your mind around the fact that there's going to be a lot of pressure at the vaginal opening, and you have to like really be calm and confident and comfortable breathing and relaxed with that pressure. And it feels more about practicing that and becoming comfortable with something that's like fairly awkward for our generation, I would assume.
Definitely agree with that. I think it's very similar to the way that we use dilators in our practice for painful sex, that it's not necessarily that the dilator is like forcibly stretching your tissue, but it is just getting your entire body and mind used to that idea of the tissue being stretched. And I think perineal massage is the same. A lot of it is, yes, learning to both just get back in touch with that area that a lot of us don't really pay attention to. And it is probably those same people who then postpartum too should probably be the ones that are looking in the mirror and seeing what's going on. I've heard so many people say that everybody tells you just like, don't look at it after you have a baby. And I think that maintaining just being in touch with that area and just connecting with it is huge.
Yeah. Um, do you have oil recommendations for perineal massage?
I don't. I know there's oils that are specifically designed to be used for perineal massage. I tend to just recommend lubricant because that's what we use in the clinic. So either the slippery stuff lubricant, or you could use an oil-based or silicone-based lubricant if you wanted something that was going to last a little bit longer. But also, coconut oil is fine to use here and there. There's a little bit of debate about whether or not the antimicrobial properties of coconut oil might kind of throw your flora off a little bit, but for the most part, I think that using coconut oil is fine. It doesn't seem to have that much of an effect.
That's interesting. I hadn't heard that about the coconut oil. I want to look at that. And how often at the end of pregnancy would you recommend it?
I would recommend a couple minutes a day for 3 or 4 weeks leading up until pregnancy, and then stopping when you do go into labor.
Cool. We have a few minutes left. I'm curious if any postpartum folks have any questions before we hop off. You all might be feeding a baby or something that makes it harder for you to type in. So if anybody wants to unmute and share a question or anything like that, take the time. Cool. Caitlin, while we're waiting for maybe another question, maybe not, would you just share how Origin is working now? Like how can people work with you or work with the, the team at large?
So I can put the link to our website maybe in the chat if that's helpful. Here, I'll stop sharing my screen. And we are currently doing a combination of virtual and in-person assessments. So we just moved to our brand new beautiful space in Brentwood in Los Angeles. And so if you're nearby, it's really like an awesome space to come visit. It's so beautiful and it's big enough that we can socially distance and actually be able to work with you in the clinic. But if you're not in the Los Angeles area, we're doing virtual sessions, or if you're not comfortable coming in as well, of course, we're doing virtual sessions, which the majority of us are licensed throughout California to do. And there's a couple, we have, I believe, somebody licensed in New York and somebody licensed in Texas, if you're in one of those states as well. And the virtual ones are good. If you are coming in for pelvic floor issues, we may be asking you to do a self-assessment with us, which is always fun. And we're just kind of working with what we've got at the moment.
I will say, so I'm connected to a lot of pelvic floor physical therapists. Again, it's like a key component of what we do at Birthsmarter. And I just feel really excited by how well virtual work is going. I think that's true for us teaching childbirth ed, but in particular, like obviously we could do a screen share and some sort of lecture component virtually, but when we're having people practice labor positions and we have partners doing massage techniques, those are the things that we were really worried about transitioning to a virtual format. And I actually find that it's more empowering for people to be at home sort of on their own, like in their spaces without having our hands on them to be like, this is what's right. There's a lot more experimentation. And so, yeah, I'm looking for all the silver linings I can get these days, I guess. But I do think there has been something that's really awesome about people taking charge of their body and their experience, and still using a coach or a guide to figure it out, but then doing the work, sort of.
Definitely. I think we've increased accessibility for so many people that, I mean, that if you just had a baby, the postpartum period is so hectic, and being able to get out of the house for an hour-long appointment sometimes just isn't realistic. Not to mention the whole pandemic thing. If you're not comfortable leaving the house, this is such a good option. And I'm very inspired by what we've been able to do virtually too.
Yeah, that's amazing. All right, no other questions came in, so I feel like we can wrap up. For folks who are pregnant, everybody, pregnant folks, postpartum folks, check out Origin. I'll send a follow-up email with it too. It's theoriginway.com. And if you're still pregnant, come take class with us at Birthsmarter. We would love to have you. Caitlin, you should come take class with us. No pressure, but
I will look into it. Thank you.
Yeah, totally. I'll send you an email. Cool. Thank you so much for being here. This was very comprehensive. I loved it.
Thank you. I appreciate it.
Hold on. One more wrap up. This is a good question to end on. Would it still be a good idea to have, two. I was cleared by my OB rather early at 4 weeks. Before I had healed, do you recommend I get checked again before sex and regular activity?
So I'm assuming you mean like cleared for intercourse?
Yeah.
Okay, so I would just go on based on what your OB was saying. If they were clearing you and saying it was okay to start at 4 weeks, I would listen to that. But if they were saying start at 6 weeks, then I don't think it's necessary to go and see them again prior to the 6-week mark. I would just wait until that 6 weeks actually happens. So don't do it before they tell you to. That's really the big takeaway, because there's so much just general healing that's happening. Your body's kind of reshuttling blood to other parts of your body where maybe it was going to the placenta before, the tissue's healing up. You just don't want to mess with that until you get the okay. So if everything looked good at 4 weeks and they said wait another 2 weeks, then just wait.
And then similar, would it be a good idea to have a consultation with a pelvic floor PT to get everything checked out, or do I have to be experiencing an issue? I feel like I planted that, but I didn't.
if it was me, I would go get checked out. I would just want to know that my strength is normal. And, you know, we can tell you like strength, endurance, coordination, everything with the pelvic floor. We can give you some numbers and say like, this is normal. This is how close you are to normal. We could make sure you don't have an abdominal separation that's preventing you from safely getting back into exercise. I think there's lots that we can tell you about preventing things like neck and shoulder pain and wrist pain and things that come with everything postpartum. So I would say I would advocate for yes, come in and see. We'll probably find plenty that we can talk about and work on.
And that's like a conversation for a whole nother time, which is just understanding how much the pelvic floor is connected to every other part of your body, right? And so like what we see a lot from a birth prep perspective is that people don't think they have a pelvic floor issue. They're not leaking, there's no prolapse, there's no painful sex, but they have a knee injury or a hip injury, or sometimes a back injury. And a lot of those are from like high school sports or college sports or job, you know, sitting all the time at their job. And it's like, every one of those people who's, you know, pregnant, who has something going on in their body, for me as a birth educator and a doula, it's like, go to PT, like go have somebody check out what's happening sort of up and down the chain, because it's all connected whether you know it or not. Yeah. Okay. So people are saying thank you. That's what they were thinking, knowing it would be helpful. Awesome.
Thank you.
Cool. All right. Thanks everybody so much. I'm going to send out the recording if you missed any of it or want to share. And we are hosting a conversation next week. I have to get it up on the website because we had a schedule situation that's about welcoming. Somebody here is having their second baby. The conversation next week is going to be about postpartum preparation when you're welcoming a subsequent baby into your family and preparing your kiddos for that. So come join us for that and all of the next ones. And yeah, great. Cool. Have a great day, everybody. Thank you so much, Caitlin.